Good evening, welcome and thank you for joining us for tonight's webinar on the employment impacts in private practice during COVID-19, an initiative of the Queensland Regional Committee. My name's Brooke Coimbra and I'll be facilitating tonight's presentation. Firstly, we would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to the land, sea and community. We pay our respects to them and their cultures and to elders both past and present and emerging. The Professional Medical Practice, or for short, PMP, is a collective of experts supporting the college through various events, providing financial wellbeing and business education for medical specialists. Tonight, we are supported by some of these experts. George Sotiris and Scott Lindeblad join us to provide you with the information to navigate your practice through the impacts of COVID-19 and how this will affect staff. We also have Paul Copeland, Director of Business Advisory at William Buck Queensland, and also the Head of William Buck's National Health Services Focus Group, and Carolyn Lopez, who is the Education and Events Manager from William Buck. From RACP, we have Tracy Handley and Hannah Parker on the line from the Queensland Regional Office, and Samuel Detman from the college's Policy and Advocacy team to help with any questions you wish to submit through the Q&A function. We're about to get started, but before we do, I'd like to just go over a few items so you know how to participate in tonight's event. You have joined the presentation using your computer speaker system by default. If you're having troubles hearing, please select the correct speaker device you are using in the bottom audio pane. That's the small arrow next to the microphone image on the bottom left-hand side of your screen. If you have any questions, you can use the chat function to communicate with me directly and I can give you some guidance. You'll have the opportunity to submit text questions by typing them into the Q&A pane of the control panel located at the bottom of your screen. Please make sure that you're submitting your questions via the Q&A button, not the chat function. You may send all your questions at any time during the presentation, and the most frequently asked questions will be addressed at the end of tonight's presentation. If your questions are not answered by the end of the webinar, we will be sending out an email within the next week with a compilation of all the questions sent through and their answers, as well as a direct contact for you to submit in any further questions you may have. Please also be advised that this session is being recorded. We'll be advising where you can access this recording in coming communications. So I would now like to introduce our first presenter, George Sotiris. George is a workplace relations specialist who understands the need of private practices. Having over 10 years of health industry experience, he has worked closely with medical practices Australia to reduce employment risk and navigate complex challenges that businesses face with their employees. Over to you, George.
Thank you, Brooke. And everyone, I'm just going to bring up the slides there. Perfect. Excellent. So thank you, Brooke, for the introduction, and everyone. It's a pleasure to be presenting tonight alongside, obviously, with the team at William Buck. I suppose we've all, we've all proceeded through and obviously have been faced with something that we've never faced before in private practice, and we've been assisting hundreds of practices over the previous weeks with navigating, I suppose, all of the employment challenges that we've been faced as a result of COVID. So unfortunately, there have been significant employment impacts that we've had to obviously reduce workloads, reduce staffing levels, the financial impulse of obviously wages in clinics. So what I want to go through today is effectively the key breakdown for everyone that's already made changes or potentially likely to make changes. I want to step you through the expectations of fair work. Whilst we're in a lot of uncharted waters here with regards to what we have to do, there are still consultation obligations we have to follow. But our objective and advice is obviously we need to keep people engaged and still employed. And obviously with Scott later, we'll be breaking down some of the JobKeeper provisions and what you have to be mindful of. So with regards to your specific situation, obviously what we're proceeding through here, there are several different avenues you can go through when obviously addressing employment disputes and matters, especially around the reduction of workforce needs and specific redundancy processes. So please make sure you get your own specific advice and customized advice from a workplace relations specialist. to make sure you're not exposing yourself to any unnecessary claims. But I want to quickly give you a bit of a breakdown around what we have been facing in our office. So I want to give you a bit of an overview for general practice and specialists, because obviously it's been completely different from both sides. And obviously with our general practices that we are supporting with, we're finding two different streams of what's occurring. So obviously the general practices that are by choice reverting to a lot of telehealth and obviously are in that position where the practitioners might need to revert to telehealth and minimize patient contact, or they've done so by choice. We're obviously noticing a massive reduction in the workforce needs. So that's obviously leading to staff either being made redundant or having a reduction in hours. What we're finding with a lot of those GP clinics is that their casuals are generally the first ones that are being reduced. But it's been actually quite interesting because there've been a lot of casual staff in these workplaces that are regular and systematic. So they've had the same start and finish time, same days, same hours for the last 10 years. And all of a sudden, COVID's happened and the employers are directing all these casual staff to go back. So what's occurring as a result of a lot of these issues is effectively cultural issues. And I suppose that trust is being broken down. So we may not necessarily have employment disputes that arise from it, but we're seeing obviously that breakdown in trust, which is in this time, everyone's very, I suppose, stressed. There's a lot of uncertainty and things that are occurring. So I suppose when you're proceeding through with any changes in these scenarios, you need to bear in mind the cultural impact you're doing. So even though you have the option to reduce casual hours, is it appropriate in the circumstance? Because what we find, most of these casual staff have either been engaged incorrectly or should be part-time or full-time. So just be cautious when you're in that predicament looking at reducing casual hours. But then yet again, what we're finding with these other GP clinics, those full-time and part-time staff are being agreed to either reduce hours or being made redundant. But on the other side of it, we have a large group of general practices that are obviously busier than ever. They've got flu clinics underway. Obviously, yes, they've reverted to some telehealth, but they still have, I suppose, sufficient measures in place to screen patients. And I suppose with your private practice as well, what has recently been introduced as a very good resource for you all, Safe Work have nationally introduced a safe work guideline in managing the COVID pandemic in the workplace. So if you jump onto the safework.gov.au website, one of the first links you'll see there is the COVID pandemic link. It's excellent. It's really great with regards to understanding what your health and safety risks are as an employer in a business and trying to handle these situations. So obviously in private practice, we're a little bit more unique because of obviously the type of people that are entering into our businesses, but as a good backbone of a legislative recommendation, you will find that safe work recommendation. So with these other busier clinics, they're also recruiting staff as well. So as I said, from the general practices, it's one extreme to the other. But with regards to our specialist practices and what we've been obviously identifying is that with the cut-off elective surgery freeze, we've had practices that obviously have operationally effectively had to stop working whilst they can still see patients and do follow-ups with telehealth without the ability to have that elective surgery freeze. It's obviously, there's no work to be done. And as a result, there's no money coming through the door and there's no work for staff. Obviously the common thing then, obviously the GPs aren't sending the normal referrals, but the patients obviously aren't coming through because they're choosing not to attend. But we've also noticed that, especially for a few of our physicians, that obviously they rely heavily on the elective surgeries and the pre and post-op appointments that come through with it. So from that side there, it is something that our specialist practices have been significantly more impacted as a result of COVID than our general practices, who still can have the option to privately bill and obviously have some of the bulk billing telehealth additions there, but the majority of their main income streams are still available, whereas for our specialists they're not. So I suppose it is very different because we are having large specialist groups and even our small ones with, I suppose, mass reductions occurring. So everyone is going to be impacted differently. And I suppose what we need to look at is that if your practice is impacted, there's been a lot of confusion. And I suppose where we look at what the process we have to adhere to is, are we standing staff down, or are we making them redundant? Are we reducing hours? There are a lot of different, I suppose, perspectives on what you have to do as an employer in this situation. However, I'll make one point clear, and especially with regards to the stand down provisions. So in a stand down situation, in our, I suppose, private practice arenas, it's probably very likely that we will have a full direction to stand down. And the scenario I'll provide, if you look at every single gym in the nation, they've been directed from the government to effectively close their doors and not to allow individuals to come in to minimise the prevention. So they have had a directive from the government to close their doors. So in those scenarios there, it is a stoppage of work because of a reason that is, I suppose, outside of the employer's control. So it is something where stand down without pay could occur for all of those staff in that scenario. However, in private practice, it's, I suppose, very different because we still have smaller streams.
George, sorry, okay. It's Tracy. Can I get you to speak up a little bit? We're struggling to hear you. Thank you.
Okay. Yes, sorry. Is that better there, Tracy?
Yeah, that's better. Thank you.
Okay, perfect. So with regards to the stand down in work provisions, as I said, it's very unlikely that we would be eligible to initiate Section 524 of the Act, because there is still work to be done, and what we're faced with is an operational downturn. So there's been a lot of advice from individuals to stand your staff down. However, that terminology isn't necessarily what we're doing. Whilst we're reducing hours and reducing the time of staff in the workplace, you can't necessarily force your staff down without pay. There are a lot more productive measures that you can take and safer measures you can take, because the last thing you want is staff claiming, I suppose, stand down hours that weren't reasonable as well. So if you have been advised to stand your staff down without pay, please do get the right advice around if that was correct and what the potential risk is. But what I will take you through in tonight's presentation is the redundancy steps and the, I suppose, mutual agreements. So even if you had the possibility to stand staff down with pay or without pay, sorry, you would still want to have some form of mutual agreement to either reduce their pay or have them go on a prolonged period of unpaid leave. But the processes we should be following effectively consist of either redundancies or mutual agreements to reduce hours or go on periods of unpaid leave. And that will be your safest options. So what we've...
I've had quite a few people still messaging me saying that your volume is quite low. So I wonder whether maybe you're in a position that you could just get a little bit closer to the computer microphone.
Okay, sorry, 1 second.
And we'll just do a sound check.
Is that a little bit, can everyone hear me better there?
Yeah, can everyone just let me know that you can hear George okay through the chat function?
Okay.
Yep, everyone's saying fine.
Everyone
Great, thank you, George.
Okay,
sorry for interrupting.
No, that's all right. So please let me know. I can obviously amend it, but with regards to the redundancy processes. So as employers, you need to be, I suppose, vigilant around what your obligations are with regards to either redundancies or agreements. So what you have to understand is that we need these staff once we effectively get back to full operation. And we need to, I suppose, take that perspective that the culture we've adapted and the staff that we have on board, we're going to need them. So whilst we don't have the income streams coming in to maintain their wages, what we're finding, and we've had reduction in staff's hours of up to 60 to 70% for up to 70 people in one workplace. And we're getting a general mutual agreement with most of these parties that they're happy to either reduce hours or times as they understand the impact of it. Obviously, we'll be going through JobKeeper a little bit later on, which can help you, I suppose, subsidize part of that wage. However, what my advice is, regardless of JobKeeper, you should still be making the appropriate operational changes to suit your business needs. And what that means is, because even if you have JobKeeper come through, will you still have the work there for the staff to complete? And most scenarios it's not. But I've obviously later on got a few tips around what you can do during that period if staff are coming in and there's no work to be done. But in this present time, with regards to your redundancy steps, you want to have redundancy as a last option. And I suppose we say that because your staff that you have on, you want to either mutually agree to reduce hours, and you want to either mutually agree to take unpaid leave in the interim. So a lot of people, I suppose, are also taking this opportunity to either restructure or have different positions varied as well. So be very cautious. And I always feel that it's not best practice when you use these situations to make, I suppose, difficult staff or staff that are, I suppose, have been hard to manage in the past. This isn't a really, whilst you may have the option to do so to make them redundant, I feel that I suppose lack of management to control that individual can put you at a very high risk situation in this environment, because they still have the rights for claim of unfair dismissals and general protection. So obviously, as I mentioned, each situation is different, but you still have to ensure that you follow the procedures. And just because you have a slight reduction in your operational workforce, you have to justify, well, why is that particular position being made redundant? Do we have genuine reasons? Have we completed skill matrix and other processes? So I'll go through the specific processes you have to be aware of when you're making changes in the actual workplace itself. And you can see I've put there clause 8 of the awards. So if you're unfamiliar, we're talking about the Health Professionals and Support Services Award, which will cover all your administrative staff and employed allied health staff in private practice. And obviously, if you do engage nurses, your Nurses Award as well. So they're the two modern awards that we work with, and you ultimately have to comply with clause 8. But what is clause 8? And in clause 8, I've just got a holding slide here, and I'll step you through what the consultation process is. So your two provisions under the award that you need to adhere to and follow during this process. So clause 8 of both awards, they're identical provisions. They effectively have a consultation process during major workplace change. So with regards to your major workplace changes, obviously we're having a major workplace change here, because if we don't have the patients coming through, if we don't have any provisions of funds coming through, obviously we have to make a process to vary hours. So what I'm going to step through here is your formal redundancy process. And it's crucial that you understand the steps and what we have to look at. Libby's just asked, when I say both awards, which awards are they? As mentioned, that's the Health Professionals and Support Services Award and the Nurses Award 2010. So they're the two awards we're talking about. And in clause 8, which you should all read in this period and while we go through COVID, these consultation of major workplace change provisions are what we have to adhere to. So when a redundancy occurs, you have to follow a fair and reasonable process, and it's outlined in this clause 8. But the first step in a simplified redundancy process is that you obviously must organize an initial meeting. So once you've made a definite decision to make a workplace change, you have to consult with your staff. So your first introduction for a formal redundancy process is to send an email through to the affected staff to state that we need to meet due to operational changes that are likely to occur as a result of COVID. We want to meet at this date and time, and you're more than welcome to bring a support person present with you to this meeting. So this initial invitation, I suppose you've complied with the first provision of clause 8. You've allowed them to have a support person present as per the provision of the awards. And a lot of people, I suppose, have been saying, well, George, do we have to provide a support person. You know, it just seems very formal, and ultimately, you know, we know these staff extremely well, and we don't want them to, I suppose, you know, think that, you know, that they need to go get legal advice, or they're going to bring in a difficult personal partner, or whatever it might be. In the end of the day, you can refer back to that. This is obviously, as recommended by Fair Work, obviously you're more than welcome to bring a support person. It is in your interest to do so, especially, and you'll be very surprised which staff members may exercise this right. But it is a provision. As long as you do not decline a staff member a right to a support person, you should be offering it as recommended by Clause 8. So when you have the first meeting, this is your first notification meeting. So during this meeting, you actually have to issue them a letter in writing, which effectively states and complies with Clause 8 of the award, which effectively says the who, what, when, where, why. So obviously, as a result of COVID, we've had elective surgery stop, or significant financial impacts, or we're closing our practice down. And ultimately, you need to reiterate what the significant effect is on that position. So say you have a full-time staff member who you have to convert or offer a casual position to. You would ultimately be stating at this stage, we will no longer be able to maintain a full-time position, and we may have a possibility of having a casual position. And even if you want to show them what the casual rates are or the terms around those arrangements, but effectively you need to allow them in this notification process an opportunity to respond. So they may come up with alternative options, different ways to introduce revenue streams to the practice, whatever it might be. You have to consider. They may outline what their family circumstance is, even though that may not change your operational decision. You still have to consider whatever the staff member recommends. And at the end of this first notification meeting, you want to ultimately state that, look, we want to, within the next 24 to 48 hours, meet with you for one final time to make a confirmed and final decision with regards to what we're doing with your role. So the timing between these meetings, I suppose the crucial thing is here, in a normal situation, when we don't have the pressure of COVID and the financial pressure at present, you should be allowing at least between 24 to 48 hours between these meetings. And that's to allow individuals to organize support persons if they have to. You know, if a staff member requests and says, well, look, I don't want to wait 48 hours. Can we just have the meeting this afternoon? Look, if they're happy to do so, and if you've reiterated that back to them via email or whatever your forms are, you obviously can bring that form as long as they've consented to. And with regards to it, make sure you comply with that notice period. If someone says, well, look, 24 hours is enough, I want an extra day to organize my support person, you should be allowing that extension there as well. So in this final consultation meeting, so you've notified them via email, you've issued them a letter and had a formal notification letter where you've outlined who, what, when, where, why, and then the final meeting is your consultation meeting, where effectively you will be making a decision to terminate their current position. So if it's whatever, a full-time, part-time or casual position, you're making a decision to effectively terminate it by reasons of redundancy. So this final process, you should refer back to your meeting that you've already had. Obviously, we outlined on this date and time the significant impact and the major workplace change that we're faced with. As a result, we've looked at ways to redeploy you. We've offered you a casual role, or alternatively, we've had no alternative role. And at this present time, unfortunately, we have to terminate your position. There's been a lot of debate and discussions with regards to what about the notice periods, or George, what do I have to pay out my staff with redundancies? So I'll break it down into a few different categories. So everyone must comply under the National Employment Standards, which is a part of the Fair Work Act. If you don't have the National Employment Standards, I'm more than happy to send out the 80, 90 odd page document out to anyone. But within the National Employment Standards, it has your notice periods, which is a period between 1 to 5 weeks, pending on your staff member's length of service. So when you terminate employment, obviously excluding casuals, you have to apply the appropriate notice period. So if someone has been with you for under 12 months, you have to provide 1 week's notice. If they're between more than 12 months, but less than 3, it's 2 weeks. Between 3 and 5 years, it's 3 weeks. And over 5 years of continuous service with you, it is 4 weeks. So if you've had a staff member who is over the age of 45 and has been with you for 2 continuous years, you have to entitle them to an additional week's notice. So that means if they've been with you for 3 years, the normal provision is 2 weeks notice period, but because they're over the age of 45, that would increase that 2 weeks to 3. So you'd have to provide 3 weeks notice to that staff member. So when you're, you have the option to have staff either work their notice period, so effectively they can stay on your books for 3 weeks and they can finish up whatever loose ends have to occur, or alternatively, you can pay out the 3 weeks in lieu of notice. So with regards to that is, you cannot contract out of the National Employment Standards. So these notice periods for your full-time and part-time staff must be paid. So for your part-time staff, it's obviously based on their pro rata hours. So if they work 20 hours a week, Monday, Tuesday, Wednesday, whatever it might be, you would have to pay those provisions on the 20 hours for 3 weeks. So that's your first major payment that you have to pay, is the notice period on termination. And secondly is redundancy pay. So it's actually quite interesting because most businesses and most private practices have not, I suppose, had to proceed down the path of making positions redundant. So it's been a very big learning curve for a lot of owners and managers proceeding through with these processes. So with your redundancy pay, it scales anywhere between 6 to 16 weeks, depending on the length of service. And I'm not going to repeat them to you all. They're in the National Employment Standards, but I'll break it down into 2 categories. If you're a small business with under 15 employees, if you dismiss a staff member by reasons of redundancy, and you're a small business with under 15 employees, you do not have to pay redundancy pay. So I repeat, you do not have to pay redundancy pay if you are a small business with under 15 employees, or if the staff member has been with you for less than 12 months. If your staff member has been with you for more than 12 months and you are a large business with 15 or more employees, you will have to pay the redundancy pay, which, as mentioned, I think around that 9-year mark, if they've been with you, it can be up to 16 weeks redundancy pay. But what we're identifying is that a lot of businesses at this moment can't actually afford to pay these large amounts of redundancy. So obviously I'll take you through a few different steps with regards to how to structure and I suppose financially proceed through with these provisions. Obviously JobKeeper will help us a little bit to keep people engaged, but we want to have mutual agreements to avoid some of these redundancy pays. So make sure you understand the size of your business. That's employees. So obviously casual staff that don't have regular and systematic employment don't count towards that headcount. So as I said, you need to get really specific advice here if you're making positions redundant. Don't just jump into it and thinking everything's fine, because there's obviously risk involved. So that process there, from the email notification, having your notification meeting and face-to-face or via Skype and Zoom, a lot of them are occurring, and issuing them a written correspondence around what, why, and how things are occurring, followed through with your final meeting of making the decision to terminate that position, is your simplified and I suppose my quick version of what a redundancy process looks like. So that is broken down in Clause 8 of the Health Professionals and Support Services Award and the Nurses Award. So this is why it's so crucial, because if a staff member proceeds to claims to Fair Work and says, well, you know, this dismissal was harsh, unjust, or unreasonable, or you don't adhere to the processes as recommended by the award, you can face the risk of an unfair dismissal claim. But obviously what we're finding, a lot of staff that are in their minimum employment period. So yet again, if you're a small business and you have under 15 employees, you have a minimum employment period or a probationary period of 12 months. So that's if you're a small business under 15, it's a 12-month minimum employment period. If you're a large business with over 15 employees, it's a 6-month minimum employment period. So these provisions, I suppose what we're finding with a lot of these redundancies, most of those staff that are in that under that minimum employment period are unfortunately the ones that are being made redundant because they do not have the jurisdictional right to lodge an unfair dismissal. So they can still lodge a discrimination-based claim or an adverse action-based claim, but it's in the circumstances because the reasons are so valid, it's probably going to be very unlikely. So as I said, if you're going down through with redundancies, please make sure that you do go through and get the right advice, because the last thing you need in amongst having all the financial pressure, the restructure, the reduction in workforce is to then have claims. So we would assume that the commissions would be obviously very lenient or a bit more lenient in these processes. But I feel that the practices that will get themselves into trouble are the ones that are targeting particular staff that have been difficult to manage, and obviously aggravating the situation may elude them to go and get formal advice. So with regards to what we recommend, I suppose I've got a little holding slide here that I will put up, and Scott will be talking about the JobKeeper. So I suppose what my tips are, we have enough of a background. I'm not going to spend too much time because I want Scott to really flesh it out, especially with the updates that we've received. But what my advice is, and it has been to all of our clients, is to, regardless of what is occurring with JobKeeper, you need to make operational changes to suit your business needs. And the reason being is because a lot of practices, I suppose, have had the initial mindset, and especially a lot of our specialist practices too, have had the mindset, oh, well, we'll just keep paying our staff until we know what's occurring. But after the first and second pay run of adhering to this, where there's no money coming in the door at all, and there's significant wage bills occurring every week or fortnight, I'm going to say almost every person that has said that to me revert back and say, well, actually, we can't financially maintain this anymore, and we can't just keep paying staff if we have no money coming through the door. So what you have to be aware of is that the operational changes need to occur to make things financially viable, and most staff understand what's occurring. Obviously, with the JobKeeper for eligible staff, the point is there that from the date in March, and I'll let Scott go through that, but I think it's around the 30th of March, somewhere thereabouts, that these provisions could be backdated from that provision. So your staff might get that top-up pay, but a lot of people are holding out to the payment in May. But if you cannot wait for that long, and obviously you need to make the changes, please proceed to and make the changes, and make sure you record the changes. So what I suppose the advice is here, and I will take you through in the next slide around how to avoid the redundancy pays and what our recommendation is to, I suppose, reduce the workforce needs. But what you're going to find is that once, I suppose, JobKeeper does come in place, if you're eligible for it, I like to look at practices will most likely proceed to some form of, I call it a holding pattern. So practices will proceed through to effectively, like you're stuck in the air, going round and round waiting to land. It's something that it will be much of a similar point, that until they open up and things get back to normality and elective surgery starts back up, you will be in this holding pattern. And if you have this eligible payment for that 6-month term, obviously, and if your staff are coming there for that nominated period of time, will you actually be then, what work will they be doing? Will they be preparing or updating all your processes, your internal policies, your handbooks? Will you be doing internal procedures, maybe some HR training? Whatever it might be, you want to capitalize on this period, because everyone that has had these extensive waiting lists and other provisions there where it's been extremely busy, it ultimately is all going to catch back up as soon as things get back to normality, and things will be even busier once most of our GP and specialist practices get back up on their feet. So you want to, I suppose, start strategically thinking about what you're going to do, but with your operational needs of your staff and the practice, As I said, the best bit of advice I can provide you is make the operational changes you need to, regardless of what's happening with the JobKeeper payment. Whilst it's a factor and consideration you have to keep in place, if you cannot physically afford to pay staff and it's creating other stress and other measures, you're better off having a mutual arrangement to reduce hours to at least, I suppose, take that burden or pressure off. And then obviously once the JobKeeper payments come through, if you have the ability to increase staff's hours and the work requirements there, you can do so. But as said, because it is creating a lot of concern. So what our recommendation is, and especially, I suppose, our obligation and as employers, and especially if we spend so much time building our practices up, achieving a culture that I suppose we want to, the last thing we want is all of this going out the window. So with regards to redundancies and reducing hours, which we're, as I said, all faced with, we want to have a very strategic approach. I feel that you have to be as open and as transparent as you possibly can be. And what that means is that trying to avoid redundancies at all costs. It may cost you money if you're large businesses, but in the end of the day, you're going to need these staff once we're out the other side of it. All the training costs, all the time you've spent building it up, everyone is faced with the same situation. So it's not like a lot of these staff can actually walk out and go pick up another paying job in our field or in our industry very easily, unless they're going to the public settings, which yet again, there may be that option, but most staff won't be able to actually be employed and would probably go on the job seeker provision. So what we want to do is have mutual agreements with our staff. So what we mean by mutual agreements, this will be a process, I suppose, to minimize the risk of redundancy and redundancy pays. But we want to have either contractual amendments or variations to part-time hours to reduce them, say, from either full-time to part-time, or if they're part-time, just reduce their hours. So what this looks like, I suppose, if you have commenced the discussions. So under clause 8, as I mentioned, under both awards, you will see clause 8A underneath clause 8. And 8A is a specific consultation process that an employer has to follow when they have a proposed change to working hours. So effectively, for your staff, and you want to follow this for all staff that have a regular and systematic pattern. So what that means, if you have casual staff that have had the same days, same hours, same start and finish times for the last 3 years, you want to be chucking them in this same boat and following this same process. But much like the initial process I provided you, you want to effectively still meet with these affected staff. And most of these discussions we're seeing are effectively across the board. So they are group discussions that are occurring to say, look, we've run our figures, we've had an 80% drop in our patient loads, we still have a 60% work capacity. You know, we need everyone to either reduce down to this 60%. Obviously, you can give whatever relevant information you have with regards to JobKeeper and how that may alleviate pressure. And that's where Scott will come in the next section to obviously answer those questions. But with regards to our arrangements, when reducing hours, we want to consult with them, outline what's happening, why it's happening, and when it's likely to affect, which is most of these scenarios are in a couple of days, we need to make this change. So when you adhere to this clause 8A and you consult with them, effectively, we've been going through a process where we've been providing staff around what this reduction would look like. And we've been running, I suppose, different figures. For example, if you're a full-timer per week, you currently get, say, $1,200. With this 60% reduction, you're now going to receive, $700 a week, and you show the different tax and super breakdowns just to give them the information to understand that by accepting to mutually agree to reduce your hours down to this capacity, this is what you'll get paid. And then you can also show, if you understand you're eligible or not for JobKeeper, what the potential top up might be as well. So by actually providing the figures, and with most of these arrangements, it either is a temporary variation or potentially a permanent variation. Most practices have been making permanent variations in the interim because we don't know if this is going to go for 3 months, 6 months, 12 months, 24 months. So having a permanent variation is the best option at this present time, because effectively, if you have a temporary variation, that temporary date period that you provide ultimately means that they will then just automatically increase back up to their original contracted hours. So you want to make sure that you document that as a permanent variation until we establish or go back to pre-COVID levels. And ultimately you'll have gradual changes. So full-time staff transitioning back to part-time arrangements, you have to do one of two things. Either offer them a new part-time contract with what those reduced hours, because obviously a full-time staff member works 38 hours a week, week in, week out. So effectively, if they're working contractually less than 38 hours, by default, the awards would convert them to part-time staff. So then all their leave accruals and hours and guaranteed hours and times would then revert back to, let's just say you reduce them back to 19 hours a week, which is half of that. You would then have to have contractually agree that you're a part-time staff member working 19 hours a week. And if everyone is familiar with the part-time provisions of the award, you really have no flexibility with part-time staff under the HPSS and Nurses Award. You have to agree on the start and finish times per day, the days per week, and the total hours they will work per week. So that's, for example, 19 hours per week, Monday, Tuesday, Wednesday, 8 till 5. So they have to be your contractual hours that are entered into. So, so you have to understand that from going from full-time and having the ability to have a flexible roster effectively gets taken away when you convert them to part-time, because the awards direct us to have those specific start and finish times. So if you are unfamiliar with the understanding of a full-time, part-time and casual under our awards, it is clause 10 of both the HPSS award and Nurses Award. So make sure you please read them to understand the context there. So the part-time staff obviously producing, if you're reducing, sorry, the other option for your full-time staff, if they are, or if you're not in a position to convert them to part-time, your easiest solution is to have them to proceed to a period of unpaid leave. So if the staff mutually agree that they will take, for example, 2 days off for a 2-month period per week, and they fill that out in a leave request form. So much like you have an annual leave, personal carers leave form, if you add an additional box in there to have unpaid leave, if you have something documented there that they mutually agree to take a period of unpaid leave off for that prolonged period of time, then ultimately you have a mutual agreement. They still stay as a full-time staff member, but their hours have obviously just been reduced down as a result of the unpaid leave that's been mutually agreed. So with all of these variations, you need to document them. So full-time staff being reduced down to part-time, or them going on unpaid leave by mutual agreement, please make sure you have the documentation to support that that was the agreement at this point in time. Because whenever anything goes to the commission, the first thing they'll be looking for is, well, what was the mutual agreement you had, or what was the agreement in this circumstance? So you want something signed, you want something agreed and documented for the variation of full-time down to part-time or reduced hours. So with our part-time staff now, and yet again, this is across both awards, it's actually a lot easier, because part-time staff that, let's just say, are working 30 hours a week, that might be transitioning down to 15 hours a week. All you need to do in this circumstance, it wouldn't be a contractual, or it would be a contractual variation, but all you have to fill out is what they call a part-time variation form. So a part-time variation form is a contractual variation where effectively you would put the new, it has 3 options in there. It has initial term, a temporary period, or a permanent variation. So you effectively complete this part-time variation form where you put the employer's name, employee's name, you would click permanent variation, and then there's a table for you then to represent the working pattern, so the start and finish time and days per week and the total hours per week of what those 15 hours will be. The staff and employer sign that dotted line, it gets kept on file. Staff can have obviously a copy of that variation form as well. And that there is a contractual variation. So if you do not have a copy of the part-time variation form for your part-time staff, I'm more than happy to send you a copy of it. But it yet again confirms what this confirmed variation is that we mutually agreed to do. So I suppose with that, obviously your casuals are a little bit more simpler. Casuals that are true casuals, you can obviously reduce their hours and you don't have to go through those consultation provisions. But as I mentioned earlier, casual staff that have regular and systematic hours, you will need to follow a consultation process where you outline it, you go through the impact, how it is, and then ultimately you can reduce it after that. And it's more so casual staff that you're treating like part-time staff is the one that I'm talking about. So make sure you have some form of documented consultation, but you can still obviously have their hours reduced. So everyone, what I've just gone through in this slide is effectively the mutual agreement process. And this is what we've been guiding all of our practices through. And effectively, it is the simplest way to then allow us, once we are operational and back up and running, to then increase everyone's hours back to full capacity. And as I said, staff are understanding. So staff, we've had very minimal staff disagree, contest, create, I suppose, headaches for employers because everyone can see what's happening and the impact on it, especially if they're working there in a full capacity or their normal capacity and there's no patients coming through the door or there's no work to be done and they're all sitting there chatting. Most practices, as said, people generally understand what's going to occur. And obviously the discussion and talk of JobKeeper has, I suppose, relieved a lot of staff, but on the other side of it, practices where we've agreed and mutually agreed to reduce hours, the interesting trend is that now all of those staff that have mutually agreed to reduce hours are coming back with this sense of entitlement of, well, now you've reduced my hours by 60% and you're going to get half of my wage that you're paying me subsidized by that $750. So I want you to either increase my hours back up or I want you to do this. But little do they know the true financial impact on the practice and all the other rent issues, all the other, I suppose, cost issues that are occurring. So even though you've reduced the amounts by that amount, and even though you might be receiving this subsidy from the government, I suppose it's still not enough to cover your loss of income. And a lot of people are still, I suppose, contesting this. So we are receiving a little bit of backlash with staff who are saying, well, you just have to pay me that amount now on top of what you're already paying me. It's just bringing out, these situations bring out, I suppose, particular sides of staff. And when they don't understand the true impact on the business, it's actually a very interesting point, and you have to be prepared for these discussions. But what you also have to remember is that you will have staff that will be living off week-to-week paychecks as well. So they'll have their own financial issues, they'll have their own personal issues. And I suppose most of these points is not to, I suppose, scrutinize and then make these staff life difficult. It's to obviously try to get them to understand where you're coming from, how we're doing this, and ultimately, if you had the work for them, guess what? You'd be giving them the hours tomorrow. So I suppose, and this is where you need to educate staff and try and involve them and include them and educate them as best as possible to understand the impact on the staffing levels and arrangements to them mutually
Hey, George, I might just jump in for a second because I'm just mindful of the time.
Yep.
If you want to, we'll just need to hand over to Scott quite soon. That's all.
Okay, not a problem. I've got one more slide, then I'm done.
Awesome.
Thank you. So perfect. On that side there, just try to involve and get staff to agree. Whatever variations you complete, my final point is you want to mutually agree to reduce hours or have unpaid leave taken. Make sure you document it. If you need any support with documentation, get the right support. Now, my final slide, and I'll finish up on this point. So it's quite interesting. So actually, as I was logging in for tonight's webinar, I jumped on Fair Work because that's what I do in my spare time. And I went and clicked on our awards, and ultimately we had the updates for this provision. So this pandemic leave provision has been included, and it was only published an hour or two ago. So this is a very timely update for everyone. So under both the HPSS and Nurses Award, it's called Schedule X. I've got a printout in front of me from the award that I printed and I've just highlighted. there are two main provisions that were effective as of the 8th of April and will continue through to 30 June, but it's likely that it will commence. But there's a provision there to have 2 weeks of unpaid leave. And if an employee is required by the government or medical authorities to effectively self-isolate, quarantine, and that may otherwise prevent the staff member from working. So there is unpaid pandemic leave is the provision. So this is probably something that, yet again, on your leave forms or other areas you would want to update. And then the other provision that they've introduced under this pandemic leave Schedule X, under the awards, is the ability to have annual leave at half pay. So that effectively means that if you need staff to, I suppose, or staff can go on half pay for a couple months so that they can still have the payment side there received. But yet again, another little note on directing staff or having staff to have annual leave is that what we're finding is that most businesses can't even afford to pay the annual leave in most circumstances. But if you've got that liability aside, great, they can now have annual leave at half pay, which would then drag out the payment to them and also bring down the liability for employers. So yet again, I've just downloaded the copies of the award. If you want them ASAP, I can send them to you, but jump on the Fair Work website, fairwork.gov.au, and you can download them straight away as well. Make sure you get them from the .gov.au website. But everyone, that concludes my section, and I'd like to thank you, but as mentioned, every situation is different. As you can tell, I could probably go for another hour, but make sure you get the right advice, understand your procedural processes and obligations under the award, and don't create unnecessary risks for your business if you don't have to. So thank you, and Brooke, I'll pass back over to yourself for that as well. And I'll be going through the Q&As as well from the discussion. I'll be responding to all the questions asked in Scott's session as well. So thank you.
Great. Thank you, George. Thank you so much for that. So I will introduce our next presenter, Mr. Scott Lindeblad. Scott is the manager at William Buck, Queensland, and has had over 13 years experience in accounting and financial services industry. He has a focus on private client businesses with a keen interest in structuring and effective tax planning. So I'll hand it over to you, Scott.
Oh, sorry about that, Brooke. The good old mute was on. Look,
we've all done it. It's okay.
George, great presentation. Thank you so much for providing that. And look, tonight, in addition to George, obviously, I'm now going to go through the tax side of things and looking at all the stimulus measures that are out there and a few of the ATO concessions at the moment. And look, while there have been quite a lot of measures out there, what I'm going to focus on tonight is the JobKeeper mainly, and also the boosting cash flow for employees payment. So that's the one that's going to come through on your next BAS. So they seem to be, from our clients, one of the most anticipated measures. And then we'll have a brief overview of the other ones, but by all means, we've got Paul Copeland on in chat and Q&A. So if you do have any questions about anything else, fire them away, and we'll try and get to them tonight. And if not, we will definitely come back to you after this session. All right, so I'll get started. What we're looking at. So we did this first one the other week, and just as JobKeeper was coming out, it just got announced, and it was a very hot topic, and it's been a week later, and the government has come along and they have decided to finally pass it through Parliament. But what they haven't done is actually fully legislate it. They did it a little bit differently this time. They have basically passed through Parliament the power for the Treasurer and the Commission of Taxation to go and implement the JobKeeper framework. So it's not 100% legislated yet, which is what everyone was all expecting to happen yesterday. But basically, nothing has changed so far, and we don't expect anything to change materially moving forward. And we would hope that that will get all 100% legislated in the next week or two. But tonight, I'm going to go through everything that is there to date, so you can get some good understanding of where you stand and basically what you can potentially start looking to do. All right, so we've gone through the summary there. Look, I will say the disclaimer as usual, this is all going to be general advice and it is all, the information here is current as at today, the 9th of April. So if you have anything that is around your personal situation, please reach out to us afterwards and we can talk to you in a more personal setting. But right now, this will all be general advice. So the JobKeeper payments. What we've heard in the news is basically the government is going to pay you $1,500 per fortnight per employee that was on your books as at 1 March 2020, as long as they do continue to be employed with you, or if they are currently, you have had to stand them down. I will go through a bit more around who is eligible, but casual employees do fall under that realm if they have been with the employer for more than 12 months. And yes, sole traders will also be eligible to apply, assuming they meet the requirements. And also there are those in the self-employed world who will operate through a trust company or partnership structure. They also get a special mention, so we'll go through that as well. But basically, on an overview, we're looking at most businesses are going to be under $1 billion. But if you're over $1 billion in revenue, you need to see a 50% decline. But the majority of us will be less than $1 billion of revenue, and we will need to see a 30% decline in our revenue. And that obviously is a very ambiguous little quote there, but the government has put out some more information, which we'll go through next. Also, if you have a charity or you are working with a charity, they will potentially be eligible where their revenue has declined by 15%. So that's a nice little boost for them. It was originally 30%, but they got the reduction there as a little favor, I guess, which is good to see. Oh, sorry, next one. So how are we going to work out this decline in turnover? Now, basically the ATO have come out, or sorry, the government so far has come out and said that there's going to be 2 tests. And we've got the basic test, and this is going to be based off your VAS. So what you have lodged for your either January to March VAS, or it could be for your projected turnover as well. So your April to June VAS, or if you're on a monthly basis, it's going to be your March, April, May, June VAS area. So what we're looking at there is they're going to be saying, well, on the basic test, if you lodge a VAS for the March quarter, and then you look at last year's quarter for, so January to March 2019, if you have had a decrease of more than 30% in your revenue, then you will automatically qualify in that regards, right? Now, in the case where we have a lot of people where they might say that from January to March, in that comparison period, it's actually not too bad and we haven't hit the 30% decline. So everyone's coming around and saying, well, can we still qualify? Because from April onwards or towards the end of March, it really work fell off a cliff. How are we going to get past this? So that's where we'll go to the alternative test. And if you're in an odd situation whereby you either have set up in the past 12 months, or as I said, your revenue is still reasonable, you can apply to them, to the commissioner, and he will look at a different test for you. They haven't given us any further concrete evidence around whether there will be specific requirements for the alternative test. But what they have said is basically it's going to be on a case-by-case basis. So our first point of call is the basic test. We're going to go through and we're going to say, all right, have we met that turnover decrease? And you can also use your projected turnover as well there. So if we're saying that basically from April to June, you know that it's going to be a significant downturn, we can also apply to the ATO through that method. But in the case where you've set up in the past 12 months and you don't actually have a relevant comparison period, or you may have taken on new doctors, or you may have bought a practice and that has really skewed the figures from last year, then you will be able to look at having the alternative test. So you won't automatically be excluded. It just means that you might actually have to go through a different method of calculating your actual decline and then providing a bit further information to the ATO so that they can substantiate it. So that's kind of where we're going to sit there. Initially, it came out with just a decline in 30% of income, but obviously everyone jumped out straight away and said, well, this doesn't make sense, and there's a lot of people who are missing out here. And within 2 days, the Treasury had added in that extra paragraph to say that the Commissioner will have the discretion, and so there will be a lot more people who will be able to be included. And this is fantastic for a lot of you who have just gone out into private practice in the past 12 months. So you are not automatically excluded. So once we've got past the turnover test, we look at, do you have eligible employees? Now, if you don't have any eligible employees, then that doesn't mean that you won't be able to get the JobKeeper payments. It just means that you may have to look at a different test. So first of all, let's look at those who have eligible employees, and they are going to be someone who is employed with an entity for a fortnight if the individual meets the 1 March 2020 requirements, satisfies the nomination requirements, and also doesn't fall into one of the exclusion periods. And I'll go through those shortly. But the key here is, were your employees employed with you and your business at 1 March 2020? If they weren't and you've hired someone after that date, they won't be eligible as an employee for the JobKeeper benefit. So it's first thing to do, look at your list of employees, who was on there as at 1 March. If they were on there, fantastic, that's your first point of call. What we're looking at then is we're going to go to what are the 1 March 2020 requirements. They're all going to be pretty straightforward. Aged over 16 years, is an employee or a long-term casual employee, and also an Australian resident, or if they're not an Australian resident, they'll have to meet a special category of visa. Now, one of the questions that we're getting all the time is, what is a long-term casual? And if someone has started in the past few weeks, obviously they're not going to be included in this area. But the ATO have come out and said that a long-term casual is going to be an individual who has been employed by the entity on a regular and systematic basis for 12 months prior to 1 March 2020. So that seems pretty straightforward. I did see a question in the Q&A before around a casual who has been with the business for more than 12 months, but works once every 1 to 2 weeks. Now, once again, in that case, I think you'd just need to do a bit more digging there. We'd want to get a bit more clarification around whether that is enough work to classify themselves as a long-term casual, and whether it's of a regular and systematic basis enough. But where you've got someone who comes in every couple of hours every week, 12 months, no problem. They're going to be regular, systematic, and for 12 months, so they will be definitely included. Unfortunately, where you have someone who has been less than 12 months, even if, you know, for the past 6 months, they've been coming in 10 hours a week, doing the work, regular, systematic, unfortunately, because they haven't been there for 12 months, they won't qualify. I'll point out, if they are permanent part-time or full-time, then they are included automatically. So what are the exclusions? And it's pretty straightforward. Anyone on the parental leave pay, so if anyone's receiving that from the government and a period overlaps with the JobKeeper payment, then they won't be eligible for it. And someone with the dad and partner pay as well, they won't be eligible for it. The other one as well is if someone is totally incapacitated at work and is already receiving a workers' compensation law payment, then they won't be eligible either. So there's a couple little exclusions there, and I think the main one there would be if you have any staff on parental leave and are actually receiving the parental leave pay from the government, they're the ones that you'd want to just do a bit of a double check over. And obviously with the ATO and the government putting out the final legislation in the coming weeks, we'll get a lot more detail around that, and then we can 100% give you some concrete answers there. So once we've gone through and worked out who our employees are, how much are we actually going to need to pay them? So the benefit that you're going to receive from the government for your eligible employee is going to be $1,500 per fortnight, and this is a gross amount. So you will still have to withhold tax on this payment for that employee as per any normal wage payment you will give them. But what we're looking at here is there's three scenarios. Firstly, if they ordinarily receive more than $1,500 gross a fortnight, then they will just continue to receive that ordinary wage. You as the employer will be able to keep that JobKeeper payment, and it will effectively subsidise your employees' wages and help you keep running that business. Now, where they ordinarily receive less than $1,500 gross per fortnight, then you still need to pay them the full $1,500 JobKeeper payment. So the clear example here is someone earning $1,000 a fortnight before tax, and they continue to be employed, they are part-time or full-time, you will need to pass on the full $1,500 and obviously withholding the correct amount of tax on that payment. And I guess this is where a lot of comments have arisen around a lot of part-time people and potentially casuals, long-term casuals are going to effectively get a pay rise here. The government didn't, they could have simply said, everyone will get, every business will get $1,500 per employee, but they only need to pass on the ordinary wage. And that would have, I guess, brought out a bit fairer outcome. However, this is what the government has put forward. So yes, anyone earning less than $1,500 per fortnight will effectively get a little pay rise. And the same thing has happened where an employee has been stood down. If you've stood them down, you must pass the payment on at the full $1,500 per fortnight at a minimum. Anything over that is obviously from, I guess, George's area and the HR perspective, and you can have a chat to him around those negotiations. But a few key points to raise here. So employers do not need to pay the super guarantee on any additional wage. So in that example where someone is earning $1,000 gross a fortnight and you have to give them $1,500 a fortnight, you only need to pay super on that ordinary wage of $1,000. The extra $500 they receive, you are not obligated to pay any superannuation on that. You can if you want, there's no reason why you can't, but there is no obligation or mandatory requirement to do so. Secondly, your employer will need to notify you that you are the primary employer and that you are going to be the one to claim the JobKeeper payment on their behalf. So this is going to be especially, you'll have to be especially careful here with all the part-time or casual employees that qualify for the JobKeeper payments. And it's really going to come down to, while it is on it's an employee's obligation, it's still going to always fall back on an employer to make sure they're doing the right checks. And once we get a bit of confirmation around everything in the legislations through, we'll be providing a few little bits of information around that employers can use to make sure that they are getting on the front foot and not waiting for their employees to notify them. The employer is going to get the confirmation up front, and then you can be sure that when you're claiming a JobKeeper payment from the ATO, it's actually a correct one and that your employee isn't actually claiming it from someone else. Because any individual who receives a JobKeeper payment can only receive one, no matter how many jobs they hold. Now, the other piece here, and this is one that I don't know if everyone is aware of, the JobKeeper payment is it's modeled on a reimbursement model, sorry. It's a reimbursement model there. So what the ATO and the government have said is that in order for you to get any ATO JobKeeper payments, you will need to have paid at least $1,500 per fortnight to your eligible employees before you can actually claim that payment. So what does that mean? Does that mean you have to rush out now and start paying all your employees $1,500 per fortnight? And how's that going to affect your cash flow as well? Well, look, basically there's and the ATO will provide further information around this, but they're going to allow a top-up payment to occur. So each $1,500 is based on a fortnight. So if you ordinarily pay someone $1,000 a fortnight, and then when you're going to make that claim for the $1,500, you can do a top up of that extra $500 to the employee, but it has to be made before you make the claim. Now, that is one way I imagine the government is ensuring that the businesses are actually passing the full $1,500 on to all their employees and eligible ones. And what they've said there, you know, the government's come out and basically said, if you need help on the cash flow, then you should consult your banks. So, you know, not the greatest outcome, to be honest, but in saying that, the Australian Banking Association did come out and they have said today that the JobKeeper program, you will potentially be able to use that with your bank as a means to get credit. So once you're eligible and you have the confirmation from the ATO that you are going to get, say, 3 employees at $1,500 a fortnight for the next however many months, then the bank might be able to say, well, we're going to give you that, say it's 10 grand up front, but when that JobKeeper payment comes in, you're going to need to pay that straight to us. So that will be something that you will need to speak to your bank about, and we are in touch with all our banks trying to get a bit of better understanding about that, given it was just announced yesterday. But that is going to be one way, especially if you have large employees, because the first payment is not going to be until May. So you're going to have to fund this $1,500 per fortnight for the months, so from 30 March all the way to the start of May, where the first payment will actually start coming through. All right. Now, self-employed. So obviously we've covered off the eligible employees, and one of the biggest questions we're getting is, can sole traders apply? Yes, they can. If you have met the same provisions, the drop of 30% income, then yes, you will be eligible to apply as well, and you will nominate yourself as the person, not an eligible employee as such. And you will still do this through the ATO, as if you did have employees. You'll just provide a little less information. The other one that we have is where a business is operated through a structure, so whether that be a trust, a partnership, or a company, and you don't actually pay yourself a wage as the owner. You just take drawings, and at the end of the year, you might get a trust distribution, or you might get a dividend paid to clear out all the drawings that you've taken. The government have come out and said that you're going to be able to nominate one beneficiary or one partner or one director or shareholder who is actively working in the business to receive this payment. So while, you know, we have a lot of clients who they might have a husband and wife or the spouses working in the business together, they don't pay themselves wages and they take a trust distribution at the end of the year, which is a fairly common approach. Unfortunately, only one of those beneficiaries will actually get to claim the JobKeeper payment. However, at least you're getting one person, because previously there was no mention of a structured person here, unfortunately. So that's going to be something that we need a bit more detail around that, but it is good news to know that if you are in a company or a trust and it's you and you're actively participating in the business, you may still be eligible for the JobKeeper payment. So as I've said, the ATO are going to administer these payments. And what we're looking at here is you're going to need to go to the JobKeeper page on the ATO, and you're going to need to register your intent to apply for these payments. If you're having any trouble with that, get in contact with William Buck and we can help you do this. If you haven't done it already, get on there now and get it done. But as I said, touch base with us if you have any trouble. What you're going to need once the applications open up is going to be the supporting documentation required to demonstrate that downturn in the business. And the payments are going to be made to the employer monthly in arrears. And then also you're going to have to keep doing monthly reporting to the ATO to confirm for them that all these eligible employees that you've mentioned are still on board. Where obviously someone is let go or someone resigns, you won't be able to continue receiving those JobKeeper payments, and hence why you have to provide the ongoing monthly information to the ATO. And as I mentioned previously, the ATO will start making the payments from May, and it will backdate it to 30 March. All right, sorry. Okay. All right, so that was basically the JobKeeper payments. And what we're looking at, what I'll say there, I'll come back to here. We're still waiting on a lot more information around, I guess, the more specifics, just making sure that the government doesn't make any further changes. But from what we've seen with all the Treasury fact sheets, we don't expect there to be many material changes. So if you're looking to start registering for this JobKeeper payment, or if you have employees who you're unsure whether they will qualify, reach out to us now and we can start working with you, because you're going to need to start getting together all that documentation to prove that downturn in income. And especially where you've just started out in private practice this year, you're going to need to be in a bit of a different position, because you're going to need to show and prove the income downturn, even though you won't have a corresponding period to, I guess, compare it with. So that's going to be obviously the JobKeeper payment. We're staying well on top of this one, and what we're looking at is I've been doing a lot of videos and updates and fact sheets around on the LinkedIn. So keep following that, because we're getting these out as soon as possible, and reach out to us if you have any questions around it. Now, the next one is the boosting cash flow for employers. This was the next big stimulus measure that everyone is asking about. So this is the one where if you have employees and you obviously lodge a BAS and withhold wages on them, withhold tax on those wages, the government is going to give you a minimum $20,000 payment or potentially up to a maximum of $100,000. And now it's going to be broken into two parts here. So what we're looking at is you've got the first phase. We've got the first phase on boosting cash flow for employers payment. They couldn't come up with a shorter name, sorry. But you're going to get 100% of the amount withheld on the employee's wages, up to a maximum payment of $50,000. And I'll go through what periods that covers. Where you actually have employees, but they don't earn enough that you need to withhold tax on their wages, you're still going to be eligible for a minimum $10,000 payment in the first part. Now, the second phase is what's called the additional payment. And basically whatever you got in that boosting cash flow for employers payment, you're going to get again, regardless of what your PAYG withholding amounts are for the July onwards periods. And once again, this is going to be up to a maximum of $50,000. So as you can see, you can potentially get $50,000 in the first period and then another $50,000 in the second period. All right, so what periods does it cover? We're looking at the first payment is going to be obviously right now your March BAS. If you're on a quarterly BAS, this is going to be your first payment period. Whatever you lodge in this period is going to be looking at 100% withholding. a credit of 100% of that PAYG withholding. And I'll go through some detailed examples in the next few slides. And that's going to cover also the June quarter. And if you're on the monthly lodgement, well, obviously you've got March, April, May, and June. The additional payment is going to also be paid in the June quarter. It's going to overlap. And then you're looking at the September quarter and then the June, July, August, and September period. So I'll skip this part here and I'm going to get to the examples. I'm looking at the time. I know I don't want to keep everyone too late tonight. So what we're looking at here is, let's say you're lodging your quarterly BAS. You've got your March BAS to lodge and you've got $15,000 of PAYG withheld from your employee's wages. You're going to get a credit of $15,000 applied to your ATO account starting on the 28th of April. Now you come and do your June BAS, so your April to June quarter. If you then have $20,000 of withholding, you're going to get another $20,000 credit. So in total, over those two BASs, you are going to get $35,000 worth of credits to your ATO account. Now, in this case, we say credit because obviously you're going to have a liability of the 15,000 and the credit of 15 is going to simply offset it. If you made a payment before the credit and you paid that 15,000 in March, you will get the 15,000 refunded to you from the ATO. But obviously in that case, you might want to look at withholding off on the payment and waiting for that credit to be applied. Now the second phase, which is going to overlap in the June quarter. So we're going to look at what you got in the first period. You got a total credit of 35,000. So on the second phase, you're going to get that 35,000 again, and you're going to get 50% of it paid in the June quarter. So around the 28th of July, it will be credited. And then you're also going to get the other 50% in the September quarter, which will be credited around 28th of October. So as you can see here, this could be a potential cash flow boost of $70,000, and it's going to be maxed out at 100,000. So up to 50,000 in each phase. Now, if you're on a monthly lodgement period, what we're going to look at here is it's slightly different. Obviously, with a quarterly lodgement, we take into account January and February months, as well as the March month. But in the monthly phase, we're only lodging March figures. So the government's come out and said, well, look, let's not worry about January and Feb. We're just going to take an estimate and we're going to say whatever you lodge for March, we're going to times that by 3, and that is going to be your credit. So in this example, we've got someone who will lodge their March PAYG withholding amount, and it's going to be $6,750. So we're going to times that by 3, and they're going to get a credit of $20,250. Now, we've made it simple. April, May, June, they've got the same withholding amounts. They get 100% of that withholding, and it's going to total $40,500 for those 4 months. And as I said, it's going to be up to $50,000. Now, the second phase, we're looking at what do they get in that first phase? They got $40,500. So they're going to get $40,500 again, except it's going to be applied in 4 equal installments across the June, July, August, and September reporting periods. So in total, this cash flow boost would be around $81,000, which is quite fantastic. Now I will go to, we'll be looking at one more example here. And it's in the case where you don't quite meet the minimum. So what we're looking at is you are on this is an example of a quarterly lodger. Now for the March BAS, let's say you only have 2,000 of withholding. What you're going to do is actually qualify for the minimum amount of $10,000, and you're going to get that credit straight away from April. Now you go to your June BAS and you have 2,500 of withholding. Because you haven't exceeded $10,000 of withholding, your credit there will be nil, and the most you will get is 10,000 in that first phase. So on the second phase, you're going to get another 10,000, and it's going to be spread over the June and September quarters. Now, the only thing that you need to do to qualify for this second phase is your business just still needs to be running. So you still need to be, even if you've had to shut down and close it down and stand down employees, you still need to be lodging those nil BASs and making sure that you're showing that you are still active and the company hasn't been liquidated or the business ABN cancelled, etc. You just need to keep going, and that is the only qualifying requirement. So in total, you could get a minimum $20,000 here. So with regards to this one and what we're saying, obviously where you might have a spouse that works with you throughout the year, and while you could pay them throughout the year, you generally just do a one lump sum in June. What you would want to be doing is bringing that forward and looking at just starting that wage in the March period, assuming that they are already an employee and you issue them the PAYG payment summaries each year anyway. So all you're doing is bringing that forward, and you'll get that boost in March as opposed to June. And so making sure that you're staying on top of it. So as we said, reach out to William Buck if you have any questions about these examples, because they can be a little bit confusing. I know a lot of accountants have reached out to me to go through these examples in detail. All right, so look, we're keeping an eye on the time here. I've gone through the JobKeeper and I've gone through the boosting cash flow for employment. These are the two biggest benefits, right? Because what we're looking at is these are actually going to help on your cash flow. So what we're saying with your BASs, get them done as soon as possible. If you've got any outstanding BASs, get them lodged as soon as possible as well, because you want to be getting as much of this benefit as you can. And any outstanding returns, well, you're just leaving this money sitting here waiting to be claimed. Okay, so the other stimulus measures, I'm going to just briefly touch on them now. If you have any questions, reach out after and we can go through them. But there was the supporting apprentices and trainees, where if you had them on the books as at 1 March, you are eligible to get a 50% wage subsidy up to $21,000 per trainee or apprentice. And what we're looking at is that will cover the period 1 January all the way to 30 September. Now, the next one is going to be the Coronavirus SME Guarantee Scheme. This is simply the government came out and they said that they were going to guarantee 50% of a loan up to 250 grand for the banks to give out. So while this is a great guarantee scheme, the benefits here is the loan term had to be up to $250,000. You had to get a 6-month holiday repayment on your loan. And the best part of it is the loan has to be unsecured. So you will need to go to your bank to speak to them about this. This is not anything to do with the government itself. You'll still need to go to your bank. The next one was the increase in the instant asset write-off, and this was an increase up to $150,000. So this is where you're a small business and you want to purchase an asset for up to $150,000. It was previously $30,000. Anything up to $150,000, you will be able to claim a full deduction for. The only caveat I put out here is it's going to be if you are going to buy a car, you are still subject to the car limit. So you go and buy a $120,000 car, you will still only be able to claim up to $57,581. And of course, you'll have to adjust for any private use there. And finally, there was the back in business investment. And that is something where if you are looking at purchasing assets over $200,000, you are going to get an accelerated depreciation amount of 50% on top of the normal depreciation rates. And I'll just highlight there, the instant asset write-off, that's only up to 30 June 2020 this year, and it's from the 12th of March. So if you bought an asset before the 12th of March, it will be subject to the $30,000 instant asset write-off. But if you have bought something between 12th of March and 30 June, then you will get it up to $150,000. The back-in business investment one is going to go all the way to 30 June 2021. All right, I'll quickly go through some of the ATO concessions at the moment. If you have had to lodge your tax return recently and have a significant tax bill, or you know you've got one coming up, get your return lodged because it still needs to be done by the due date, but you can apply for a payment extension until the 12th of September, and there is no interest on these loans. So that is a fantastic outcome. We've had a lot of clients have a large tax bill just recently, and it's one of those things whereby it was always coming due and they knew about it. However, obviously business has taken a turn for the worse, and we've simply contacted the ATO on their behalf, got the extension, and the ATO were happy to waive the interest until the 12th of September. So if you're in that boat, don't hide away from getting your tax return done, because you're going to get that extension. So get on top of it, get your tax info in now, and let us help you get it done. And then we can go and apply for that extension for you, interest-free. All right, the next one, look, not sure how many people will take this one up, but if you're on a quarterly GST reporting cycle, you can switch your reporting to monthly, where you would normally get a large GST refund. You can obviously start getting those refunds on a monthly basis. What I would say, keep in mind that if you do choose to do this, you have to keep reporting on a monthly basis for 12 months. You can't just do it for a couple of months and then change back over. But once again, reach out to us and we can look at your figures and whether it's really worthwhile doing it. Now, this is a big one here, varying your PAYG installments. Obviously, your March installment has come out, and the ATO normally require you to pay 75% of your total installment amounts as at March, and then you have a small 25% top up normally, and they would generally issue you penalties potentially if you didn't do that. So they've come out and they've said, you know what, you can actually vary this installment to nil. And on top of that, if you've paid installments for September and December quarters, you can claim those back as a credit and get a big cash flow injection into your business. Just be careful though. What this is, it's a tax deferral, right? There is no waiver here. When you lodge your 2020 tax return, you are going to end up lodging a tax return with no installments paid or less installments paid, and you're going to have a lot larger tax bill there. All right. Oh, sorry, I've just clicked something there. And I'm just about to wrap up now for everyone. Last little point there is the ATO have been very generous on remitting interest and penalties for any debts incurred after the 23rd of January. And also they normally charge about 9% general interest charges on any payment debts. Even if they're existing, you will potentially be able to get those payment plans put in place. So all we're saying here is don't put your head in the sand. If you have outstanding debts at the moment, or you have BASs that you need to lodge, or taxes that you need to get up to date, don't put your head in the sand because you're going to get hit with big bills. The ATO have been very flexible and very generous on their interest and payment deferrals. So it's best to get it in, get on top of it, communicate with them, and then we can help you manage that as well. And what we'd say here is reach out to myself or Paul Copeland, because the biggest thing here with all these stimulus measures, whether it be the JobKeeper or the boosting cash flow for employers payment, the biggest thing is you need to get your tax planning done this year, because you have still had 9 months of good profit for most businesses. And yes, it may feel like all of a sudden you're going to lose all of that profit. It's best to get some projections done, work out what is your taxable income actually going to be for the 30 June 2020 year, and then make the adjustments to your installments, and also look at what you need to do, get confident in what is your taxable position right now, because we don't want you varying anything to nil and then realising when you lodge your return that you have a significant bill next year. All right, look, I've rushed through it a bit tonight, obviously, just to try and keep the time, but reach out to myself or Paul if you have any questions at all. And I'll pass it back to Brooke now. Thank you so much, everyone, for listening.
Thank you so much, Scott. And I know we're a tiny little bit over time, but if everyone can just hang in with me just for a moment, I've got a final few bits and pieces of information for you and some information about where you can get more information than what our presenters have given tonight. So if you're based in WA, you can join another stimulus package webinar specifically focused on the state-based information. Please email racp.wa@racp.edu.au. This webinar starts in an hour and the staff are waiting to send you the link. For Victoria and Tasmania, their webinar is on the 16th of this month, so the 16th of April, from 6 until 7 p.m. Australian Eastern Standard Time. Please email racp@racp.edu.au to register your interest. We'll be sending out answers to all of your questions, including those that were unanswered during this session, to ensure that everyone gets a response. And we'll also be adding extra information to the ones we have already answered this evening. Along with this, we're also going to be sending out the CPD link to log this evening's event, a free consultation form from both presenters, which will include an opportunity to ask more specific state-related questions regarding your own situation, a link to the event's recording tonight, and a link to an evaluation survey. So if you could please consider completing this as it shapes what we go on to offer. There will be an opportunity for you also to suggest future events. Also, final reminder of the COVID-19 information via the button on the RACP website, which details all of the work the college is doing to support members and advocate. It's all there for you. So you can just go to www.racp.edu.au/news-and-events/COVID. So that concludes tonight's webinar. Many thanks to Scott and George, Paul, and the whole team behind tonight. And it was a wonderful presentation. Thank you all for joining us. And please watch out for this email. You should receive that by the end of next week. And good night to you all. Just don't forget to select leave meetings when you're leaving tonight to ensure that you jump out of the meeting. Good night and thank you all.